Hello, welcome to our live stream. Today we'll be talking about, the topic for our seminar is working the numbers, practical tips for weight loss and diabetes. I'm one of the speakers. My name is David Ahn. I'm an endocrinologist at the Mary and Dick Allen Diabetes Center, pictured on the logo on the bottom right of your screen. I'm the program director there, and joining me on this session is my co-host.
Hello, I am Samantha Markovitz. I am a National Board Certified Health and Wellness Coach, and I am the supervisor of health and wellness initiatives here at the Hoag Mary and Dick Allen Diabetes Center. Great,
so we will get started. So here's a quick outline of what we'll be talking about today. So as you can tell from the title, we'll be talking a lot about weight management, in particular obesity and diabetes. So first off, we're going to start by discussing the connection between obesity and diabetes. The bulk of the talk will be about what we call the 5 pillars to weight loss in people with diabetes. Throughout the talk, we'll kind of talk about evidence-based recommendations, and that's basically the fancy medical term for scientific logic for why we make these recommendations. And we'll also talk about some new and future weight loss therapies as well. Great. So to kind of talk a little bit about obesity and diabetes, as you all are probably well aware, obesity and diabetes are definitely on the rise. And so I have a few heat maps that you can kind of look at to see where in the country the rates have gone. So darker is worse or higher rates, and on the left is obesity. On the right is diabetes, and as you'll see as we go through some of these dates that a lot of times they're growing in the same parts of the country. So there's only 3 slides, but so this is the data from 1994, and this is the data from 2000, so definitely getting hotter in not the good way. And then when you look at 2015, the rates are much, much higher, kind of everywhere, but especially in many of the same places between obesity and diabetes. So it's not a surprise to us at this point. I think it's a very common talking point that obesity and diabetes is on the rise. So definitely it's a very relevant topic that unfortunately is very applicable to us. And if you're anything like me or many of my patients, the past year was also not so kind for weight and diabetes. Just because, stress levels, being, stuck at home, eating a lot of comfort food, trying out new pastries, things like that, not being able to exercise due to gyms being closed, definitely was not a good year for weight and diabetes for many of us, including myself. So a lot of this will hopefully be helpful for us as we try to, kick back into good habits and try to get our, summer bodies going. So I want to talk a little bit about just the physiology behind weight and how inactivity and obesity cause a lot of medical problems. This is a very scientific textbooky slide, so don't worry about all the fancy words or all the pictures, but it basically is just showing that the less active we are and the more fat cells we have in our body, it causes our body to be in a state of chronic systemic inflammation. And inflammation is not good because it increases a lot of bad chemicals and our body just doesn't process things properly, which leads to a lot of medical conditions or a lot of complicated complications of medical conditions. So that takes us to this slide, and this is kind of a nice summary of all the negative downsides of obesity and having excess fat cells on our body. I won't bore you and read every complication here, but it's definitely worth kind of maybe pausing on a future stream and kind of reviewing everything, because it really affects everything from our breathing to our reproductive abilities, to cancer, to our bone health, to back pain. So it definitely affects so much. And even beyond this graph, there are also added complications of obesity, right? So for example, rates of dementia and memory loss are higher in people that are obese. There's a lot of mood disorders and psychiatric corollaries and kind of associations between obesity and mood disorders. In addition, sexual dysfunction. So one of the things not pictured on the last slide is that testosterone, for example, in men, testosterone levels go down when people have a lot of adipose tissue or fat cells on their body. So losing weight can actually increase your sexual performance, which is obviously very important to many of us. I think the other things that are very key, and this kind of affects everybody, and I think we all can recognize how much obesity affects it, how it has a personal and social cost, right? So I think when going for job interviews and things like that, I think the way that society views people that are obese is different than they view people that are not obese. And there's a lot of negative stigmas associated with being overweight or being obese that has costs, socially, professionally, and in so many different ways. And so it does kind of highlight that our society overall has significant weight bias and discrimination. And so, if you do a Google search on obesity, these are the types of images that you see. For example, that picture on the right is from The Guardian, which is a newspaper. And they always kind of have this picture of it's kind of a negative picture of, oh, you're eating too much, you're not walking around enough. And there's just a lot of shame associated with it. So that can be very, it's definitely a complication related to obesity.
And would you also say that there's a relationship between insulin resistance and excess weight, and how those things are related between type 2 diabetes and obesity?
For sure. And so, both of us work at a diabetes center, so that's something that we're very passionate about. And yeah, the more adipose tissue or fat you have on your body, the more insulin resistant you become. So whether you have type 1 or type 2 diabetes, you can become more resistant to insulin, meaning you might need more insulin to have the same desired effect. And if that term insulin resistance sounds familiar, that's basically the underlying mechanism that is the main problem in type 2 diabetes. So that's why you hear a lot of people that lose dramatic amounts of weight that are able to come off of a lot of their type 2 diabetes medications, because they're kind of effectively reversing the underlying process behind type 2 diabetes. So it has a huge effect on insulin resistance and type 2 diabetes especially. So the bulk of the presentation will be talking about weight. Most of it will be very relevant to people with diabetes, but it will also be relevant for people that don't necessarily have diabetes, because some people that are overweight or obese don't have diabetes. So you'll kind of see from the rest of the topic that we'll be talking just a lot about weight management tonight. So as we kind of go into it, one of the questions that comes up a lot is, isn't it all about cutting calories? Isn't that just what the key is to losing weight? And the answer is that it's generally true, but it really isn't as simple as that. So first off, certain diets are a lot easier for patients to adhere to, right? So every person has certain tendencies or certain weaknesses. So not everybody can follow the same diet just by following a low-calorie diet. So it's not always that simple. And then there's a lot of confounding things like medications, and we'll talk about this later. But medications can make it harder to lose weight, and many people are on many medications. So if a medication you're taking is making it harder to lose weight, it's not just about eating less and calories in versus calories out. In addition, other medical realities like menopause can lead to increased weight and abdominal fat. Products like artificial sweeteners, the good news is that they have 0 calories, but they still may lead to weight gain, and some studies do correlate them to worsening blood sugar control or other medical issues. And the other thing about the whole calories in versus calories out debate is that the body fights weight loss incredibly hard. And this is where I always feel bad talking to my patients that are trying to lose weight, because I would love to be able to tell you, like, all you need to do is just eat less and you'll get there. But the hard part and the hard truth sometimes is that the reality is the deck can be kind of stacked against you when you're already struggling with weight management and obesity. So what I mean by that is, for every 2.5 or 2.2 pounds of weight that you lose, your metabolism actually slows down. So that means your natural rate at which you burn calories slows down by about 30 calories per day. And not only that, you also become more hungry, meaning that you crave about 100 calories more per day. So this is why it might seem, and in a way it can be reassuring. It kind of depends on how you want to look at it. But if you've ever been in the situation where you're trying really hard to lose weight, and just to maintain your weight, you feel like you're having to swim upstream. Like you look at your friends around you and they're eating more than you and they're not as active as you, but you feel like you're having to work harder to keep that weight off. The unfortunate reality is that's actually true. You are, the hand that you've been dealt is a little bit harder. And like I said, I would love to kind of give you great news and say that that's not the case, but unfortunately it is. And sometimes it helps mentally just to know, like, the reality is I have to work harder to lose weight. So it's something that's important to realize. So weight loss is hard, and diabetes, in addition, may make it even harder. So I promise I'll get to good news, though. This is all bad news. So the good news starts to come here, and when we talk about how much weight do we actually need to lose before we start to see benefits in our health. And I think this is where, as a provider, a lot of times people have kind of unrealistic expectations of what they want to do. Or maybe not unrealistic, that might be a little bit, I don't want to assume things, but sometimes more than they need, for example. So a lot of times patients come to me and they want to lose 50 pounds, 100 pounds, which is fantastic, and I don't want to dissuade them from that goal. But the reality is even at just about 5% weight loss is really where you start to see real meaningful improvement in numbers like your blood pressure, your cholesterol, your blood sugars. So even a 5% weight loss, which might not seem like that much. So say, for example, you're 300 pounds, losing 5% of your weight is 15 pounds, which might not seem like, when people think about losing weight, they're probably thinking about way more than that. But even losing 15 pounds at 300 is going to be meaningful for some of your health outcomes. Now, obviously, if you lose more weight, you're going to see improved benefits. So at about 10% weight loss, you'll start to see improvements in your breathing, in maybe like your back pain and hip pain, greater improvements in those numbers that I talked about. And then once you start hitting like 15% weight loss is where you see like optimal improvement in the outcomes for diabetes. That's where you start to see like significant reduction in the amount of medications that you need to take and things like that. But even 5% is really where you start to see those numbers. And that's kind of where I like to start with patients. Is let's start by setting realistic and achievable weight loss goals. And so the CDC has this quote where it says, "The good news is that no matter what your total weight loss goal is, even a modest weight loss such as 5 to 10% of your total body weight is likely to produce health benefits such as improvements in blood pressure, blood cholesterol, and blood sugars." So, and this was also when everybody trusted the CDC. Right now they're going through a little bit of a harder patch. But I think we can all trust them on this comment. All right. Did you want to say something?
I would love to. Thank you. I was just going to note also that in the National Diabetes Prevention Program, the kind of guideline there is to encourage participants to lose 5% of their body weight. So it's definitely an evidence-based recommendation and a really great place to start. And talking about goals is kind of my special area as a coach. Something that we talk about with goal setting is setting SMART goals. So SMART goals are goals that are specific, measurable, attainable, relevant, and time-bound. So something to keep in mind if you're going to be setting a weight loss goal like this is to break it down even further, because it's a lot harder to say, let's lose 5% of my body weight. Something that you might look at that could be impacting your weight might be, let's say, soda drinking. That's an easy place where people sometimes feel like they can start, subtracting some of those additional calories from their intake. And maybe you say to yourself, instead of saying, I'm going to quit drinking soda, which is a pretty tough thing, you can kind of come back and forth on it. Maybe you say, I'm going to cut back by 1 soda every day for the next 7 days, and I'm going to start that by next Sunday and check in with myself the following Sunday. And it's something that is easily measured. It is bound to a schedule, so you can hold yourself accountable to that timeline. And it's relevant to the goal because we know that that's something that can help get you closer to where you want to go. So when it comes to setting these goals, it's important to think about how to make them smart and how to get started even with one small step, because these small steps lead to big wins, and it's really important to celebrate these small achievements along the way. It's a big journey.
Great. Yeah, that's awesome, and I really appreciate that. And that kind of leads nicely into the bottom half of the slide, which is why we would strongly recommend that people utilize resources that might be available to them to offer kind of a high intensity, higher accountability type environment. So for example, the use of coaches, like people like Samantha, you can get great pearls of encouragement and kind of concrete practical advice, just like she shared now. You also have dietitians that are available. There are a lot of commercial programs that offer assistance with weight loss. So for example, things like Weight Watchers, Jenny Craig, MetaFast, Noom is one of the popular app-based ones these days. And a quick note kind of on Weight Watchers and Jenny Craig, going through my medical training, you always hear about these things. I personally had not had much personal exposure to them, but they've actually done long-term studies on Weight Watchers versus Jenny Craig versus kind of standard low-calorie diets. And Weight Watchers and Jenny Craig do have good evidence behind them to support that they're very healthy, robust weight management programs. So, just in case you might have a little bit of suspicion like I did, just because it's like, wow, they market a lot, or, are they really trustworthy? But these are all, very reasonable weight loss strategies, and they aren't too extreme or anything like that. Also, you might utilize things like group visits, do phone calls for accountability. You might want to get a referral to a comprehensive medical weight loss clinic, or utilize people like coaches like Samantha.
I'd love to add a quick note too. If you are going to work with a coach, a couple things to help you find someone who's going to really be available for success and evidence-based learnings and all these things that we're talking about, basically making sure that you're working with someone who really does know how to walk alongside you and guide you in this journey. You want to look for someone who is national board certified. So this basically means that someone has attended a credentialed program, they've participated in coaching hours, and they've sat for the exam, and they've gone through these rigorous progress journeys to make sure that they get to that point where they can make an effective change. And also, the term health and wellness coach is not a regulated term the way that, say, registered dietitian is. So there are some, say, like multi-level marketing companies that call their salespeople health and wellness coaches, and maybe they don't have any formal training, or their whole business is selling products that may or may not be effective for your goals. So something to be aware of is to ask those questions, what their background is and how they go about helping you in your journey. And also knowing that a board certified coach or anyone that you work with should be working to help you on your journey that's aligned with your values. It should be directed by your needs and desires, and that they should have unconditional positive regard for you in your journey as you're working together.
Totally. And I think, the bottom line there is really, as it is often is the case when it comes to health and medical decisions, you want to go to things that are trustworthy, that have certifications, that have gone through third-party review processes. So that's kind of why I highlighted that things like Weight Watchers and Jenny Craig, even though you hear about them through commercials, they do have medical validation. Things that might not or probably don't are going to be things like, Instagram influencers trying to sell you tummy tea or something like that. Probably not going to be a great idea long term. So that takes us to the 5 pillars of weight loss. And so basically, it's nothing rocket science. I'm sure you're kind of underwhelmed by these 5 pillars because they're fairly obvious. But at the same time, I think they do kind of encompass a lot of the different things that are important to losing weight. And so those are diet, exercise, behavioral interventions, medications, and potentially even surgery. Obviously, not all of these are necessary, but they are available to people, and we'll talk about them. So first off, we'll talk about diet, and naturally, this is the cornerstone of weight loss for all patients, and it really is the foundation on which all the other pillars rely. So whereas things like medications and surgery are obviously not recommended for every patient. The reality is eating a healthy food, like choosing the right foods to eat, is really a pillar for everything else on which we'll be talking about. So the natural question is which diet is the best, and this might be why you tuned in. And so I've listed here a lot of different types of diets. This is probably still only half of the diets that we're asked about by our patients all the time. But a lot of these you might be familiar with. Some are a lot more hip and popular these days, like the keto diet or the whole food plant-based diet. Those are things that people are talking a lot about these days. Intermittent fasting. Some of these will do a little bit of a deeper dive, but just to show you that there are a lot of different diets out there, and sneak peek of our answer is that it really isn't going to be a single answer for everybody. It is kind of an individualized choice, but we'll hopefully share some pearls that will help you pick one that works best for you, and kind of address some of the more popular fad-ish diets for now and talk about their validity. Anything?
Yes, I always like to say the best diet is the one that addresses your needs, your personal medical history and background, and is the one that works for you. As Dr. Ahn has said, and I'm sure we'll continue to emphasize in this presentation, everyone's body is different. Everyone's journey with weight management or type 2 diabetes is different. And so working with your provider or your team to figure out which of these addresses your needs and your medical history in order to be something that is sustainable for you to lead to success, that's the best diet.
For sure. So going to the American Diabetes Association, who is kind of in diabetes world, is kind of our leadership organization that we trust. I did want to highlight this statement, which is that it says, as all energy deficit food intake will result in weight loss, eating plans should be individualized to meet the patient's protein, fat, and carbohydrate needs while still promoting weight loss. So that is basically a fancier way of saying what both of us just said, which is that you want to pick the right diet for you. But the reason why I wanted to highlight that is I think the ADA has kind of gotten a bad rap due to kind of recommendations in the past. So you might hear people say, oh my gosh, the ADA tells people to eat more carbs or doesn't support low-carb diets. And while that might have been the case, say, 5 years ago or 10 years ago, they might have said things like, don't do low-carb diets because they're bad. That's definitely not the case now. And the American Diabetes Association has updated their dietary recommendations to basically say that anything that really helps result in weight loss can be a reasonable diet. So they're a lot more open-minded now. So just throwing in a defense for the American Diabetes Association.
Such an important update to bring to everyone's attention, because I think a lot of people don't know that those recommendations have shifted and that there's that research that's come to light over the last few years that does support some of these other diets that were previously looked down upon as being potential helpful tools.
Totally. And I think we'll be talking more about some of those. So going back to the ADA dietary recommendations, so basically they say significant weight loss can be achieved with programs that achieve a 500 to 750 calories per day energy deficit. So a rough estimate would put that at about a 1,200 to 1,500 calorie daily limit for women and about a 1,500 to 1,800 calorie limit for men. That is a rough guideline, obviously, but dependent on height, activity, things like that. If you're, a 6'5" NBA player, obviously that's going to be a lot higher than if you're a desk worker who's 5'7". Very different. But those are some rough estimates. Also, dietary interventions may differ in composition. So, for example, limiting high fat or limiting high carb foods. So that kind of goes to the fact that you can really do different types of dietary interventions, and it's really finding the thing that fits for you. And meal replacements may be an option. So meal replacements meaning things like shakes or something. So swapping out your lunch with like a protein shake or something like that can be useful.
Would you say that if someone is wondering who to consult about figuring out what their daily calorie allowance should be if they're looking to lose weight, maybe a registered dietitian would be a good place to start? Right.
So that's definitely one of the things that registered dietitians are trained to do. as a kind of looser estimate, obviously it's not going to be as individualized and tailored to you, but a lot of these, weight loss apps on smartphones also do some rough estimate. They'll kind of ask you like your height, your weight, your sex, how active you are. But obviously, if you want a true official, individualized recommendation, a registered dietitian would be best. So going on this whole individualization theme, their recommendations suggest that there is not an ideal percentage of calories from carbohydrates, proteins, and fats for all people with or at risk for diabetes. And therefore, this kind of sums it all up. The diet should be based on medical conditions, preferences, food availability, cultural circumstances. It really is a no one-size-fits-all approach. And this is why I actually love the fact that something like a low-carb diet and a whole food plant-based diet can both be used to help people lose weight and manage their blood sugars. Because, some people are carnivores, right? They really enjoy their meat. And, you don't want to have to give up your meat if you really enjoy it. Similarly, you have people that really, really naturally tend to prefer not to eat meat. And so it's great to know that there are good options on both sides of the spectrum that can help you lose weight and manage your blood sugar better. All right. So obviously, not every diet is going to be healthy. I remember about 10 years ago, I think Winter Schnitzel had like a fake marketing campaign about the French fry diet. And if that worked, I would love that diet because I absolutely love French fries. But unfortunately, that's not going to be a good diet. So here are some key factors among healthy eating plans. So generally, the healthy eating plans emphasize non-starchy vegetables. So just as a quick review, the starchy vegetables are going to be things like root-based vegetables, like potatoes. So the non-starchy vegetables are going to be things like green vegetables. Also, the healthy diets tend to minimize added sugars and refined grains, and they generally choose whole foods over highly processed foods. So those are kind of the overarching themes among the healthier eating plans.
I also, if I may, would love to add, pick one of these factors. Maybe you decide, okay, this is really overwhelming. I don't know which of these diets I'm going to choose, but I know that I want to put an emphasis on non-starchy vegetables. And then the focus there isn't even on taking anything out of your diet so much as it is adding maybe more leafy greens. And the more room you make for those leafy greens, you're naturally going to have to move some other things to the side over time. And then before you know it, you've started a new healthy habit. You're starting to eat in a way that maybe you're starting to see these positive results in your blood sugars or your weight. And then it becomes easier over time to continue to choose these additional factors or find a diet that fits really well for your needs.
For sure. And I think that's a great example of sometimes even just doing one thing can lead to a cascade of other things, right? So for example, if you're eating a bowl of salad or you're introducing a bowl of salad before every meal, because that's your single, actionable goal that you pick, there are a lot of side benefits to that because one, that's more food in your stomach. It might give you more time for the food to make you full that you are eating. And you might find that you like salads. So there's a lot of side benefits, and sometimes simplifying it to one simple rule or goal to follow can be very meaningful. So what about the keto diet, right? So maybe in the past 5 years, I think the keto diet has come on really strong. And you might even be saying what is the keto diet? I hear people talk about it. I hear the young people talking about it. Who knows? And so what it is it's a very low carbohydrate diet. And it's quite low. So it basically, the true definition would be to eat less than 20 to 30 grams of carbohydrates a day, which depending on your familiarity with counting carbs, that's a pretty extreme low number. It does tend to have about a moderate amount of protein and a moderate amount of fat intake. One of the things that people like about the keto diet is that it does tend to lead to immediate weight loss faster. And a lot of that is because in the beginning, there's a loss of water weight. So there's a little bit of a diuretic effect. So your weight on the scale kind of starts to tip earlier. And this has been shown in long-term studies. So one of the landmark studies compared, so the keto diet is essentially an aggressive low-carb diet. So one long-term study compared low-carb diets to low-fat diets to low-calorie diets. And over the 2-year mark, they all actually had similar amounts of weight loss, but the low carb diet did lead to a faster rate of weight loss in the beginning. So if you're the type of person that really finds motivation in kind of seeing the number go down on the scale, something like a low carb diet can be very meaningful. Because I know for me, sometimes it's discouraging when you've eaten clean for like a week in a row and your scale gives you the same number back. But generally, if you cut carbs, and especially if you go keto, you start to see that number tip down pretty fast because you start to lose that water weight. Also, you'll hear people talk about some potential benefits of having ketone bodies. And ketone bodies are basically a byproduct of the keto diet because your body goes a little bit into like a starvation mode and starts to generate these things called ketone bodies. And these ketone bodies that circulate around your body actually have a little bit of an appetite suppressant effect. So if you talk to someone who is very excited about the keto diet, one of the things that they'll tell you is that they actually don't feel very hungry anymore and that they get full very easily. And part of that is because of this natural appetite suppressant effect. Also, some people will talk about this thing called Keto Clarity, where they feel like they have a little bit more focus and they're able to like think clearer. It might be a little bit of a placebo effect, but the possible scientific explanation for that is that your brain can utilize ketone bodies for fuel. And so perhaps it's kind of an efficient fuel source for your brain. So these are kind of these are the reasons why people gravitate towards the keto diet. So I guess I should explain, so in this picture, the reason why there's these food items pictured is that these tend to be very, very low carb and a little bit higher in protein and fat. And these are the types of foods generally that you'll eat on a keto diet. And like many of these diets, even the keto diet has many different flavors. I guess that's probably the wrong word to use, but many different variations. So not all keto diets are the same. So one common question that comes up is, don't keto diets, if you're eating more fats, doesn't that cause you to have heart attacks? And it's a really difficult question to answer. So the reality is that long-term, large randomized trials, those are the types of trials that scientists like me really value because those are going to be the least swayed by bias or like one person who kind of is an outlier. They're really hard to do on any type of diet because they have to be done over such a long period of time. And the reality is no one wants to pay for these studies to be done, right? So for example, if you're trying to prove the validity of a medication or a vaccine, you have a company that can benefit from that vaccine or medication. So it's not hard to get the money to pay for these studies. Now, no one really profits off of any diet. So it's really hard to do a long-term, large randomized study on any specific diet. The other thing that makes it really hard to analyze data when looking at diets is that every study defines low carb and low fat differently. So one study might say a low carb diet is less than 60 grams of carbs a day. Another study might say it's less than 20 grams of carbs a day. So it's hard to kind of compare different studies. And also, just because a study tells someone to follow a specific diet doesn't mean that people actually follow the diet, right? If you're anything like me, you know that what you're told to do doesn't necessarily translate to what you actually do. Yeah, real behavior is very different than what the study wants you to do. Another thing to think about is saturated fat. So that's part of the reason why some people talk about keto diets not being healthy, is that certain people following a keto diet will actually eat a lot of foods that have a lot of saturated fat. So things like red meat and beef has a lot of saturated fat. But even then, the scientific community is pretty divided on how bad saturated fats are. So generally speaking, we don't like to recommend too much saturated fat like red meat. But some studies are showing that perhaps it's not as bad as we thought. Maybe if you're cutting your carbohydrate intake, maybe those saturated fat sources aren't as bad when they're not eaten in combination with carbohydrates. So the summary is that there really is not a clear-cut, solid study that shows that long-term keto diets will increase cardiovascular disease more than any other way of eating. And the reality is that going back to this whole theme, any diet that helps you lose weight and keep it off is likely to improve your blood sugar numbers, improve your blood pressure numbers, improve your cholesterol, and therefore all those things are going to lower your risk of mortality. So if your diet you're following is truly helping you lose weight and keep it off, it's probably more helpful than harmful.
And Dr. Ahn, would you say that it's easier if someone does decide to adopt that diet, that their doctor can monitor pretty easily through their lab results to see if it's something that's effective for them, or maybe they need to make some tweaks?
Definitely. So for my patients that choose to go on a low-carb diet like the keto diet or the Atkins diet, I'll often do another cholesterol check 3 months after they start, just to make sure that their cholesterol levels aren't dramatically rising as you might fear. And more often than not, the cholesterol numbers actually get better as people lose weight, even if they are increasing their fat intake just a little bit. So yeah, it's important to kind of monitor those things with your doctor. And obviously medical history plays a role, right? If you have a very strong family history of early heart attacks and deaths, and your cholesterol is sky high, then yeah, sure, maybe the keto diet isn't the best choice for you. So the question that I get asked a ton, and I'm sure my dietitians get asked this even more, is how many carbs should I eat? And it's kind of, you would think it's a super obvious question, right?
There must be an answer.
Yeah, exactly. And I always feel bad when my patients ask me this, because the answer is actually that there is no clear answer on how many carbs you should eat. So just for reference, a standard American diet would have about 300 grams of carbs per day. And kind of for adults without diabetes, some people would recommend about 130 grams of carbs per day. But that's really, that's just kind of a starting point. The other thing that makes things complicated is that not all carbohydrates are created equal, right? So there's something called the glycemic index. So eating white rice, for example, and brown rice, or wheat bread and white bread, often actually have kind of the same amount of carbohydrates if you look at a slice of wheat bread versus a slice of white bread. But the difference is that the wheat bread is more of a complex carbohydrate, so it takes longer for the body to break it down into sugar. So that's why things like white bread and white rice are worse than wheat bread and brown rice, even though the carb counts are kind of the same. Now, that being said, reducing carbohydrate intake for people with diabetes definitely has been shown to improve blood sugar. And that's why, as an endocrinologist, I tend to favor slightly low-carb diets, because it translates more directly to blood sugar benefit. But keep in mind that the reality is that all weight loss-inducing diets will usually improve blood sugar. And so once again, going back to the ADA recommendations, they say for select adults with type 2 diabetes not meeting glycemic targets, low or very low carbohydrate eating plans are a viable approach. And once again, that's a direct change to kind of old school ADA thinking. And this is kind of a more modern approach where they are supportive of things like a ketogenic diet or an Atkins diet. Not that they necessarily go out of their way to recommend it, but that it's a valid option. So to answer this question, really anything from as low as a 20 to 30 gram carb per day diet to something closer to like 150 or 200 grams of carbs a day. Generally, what I'll say with my patients is consider how many carbs you're eating now and reduce it. As long as it's less than what you're eating now, then it should lead to benefit. That's kind of what I'll say as a starting point.
It's a good place to start. Everyone has to pick a place where they're going to kind of say this is where the journey begins, and even if it's 5 carbs less, maybe that's a good place to see how it works and keep going from there.
Totally. All right, so what about low-carb, high-fat diets? And this is kind of the same thing as a ketogenic diet. So a ketogenic diet, some people will refer to it as a low-carb, high-fat diet. So I'll kind of go through this a lot quicker. But yeah, it may improve blood sugars, may improve cholesterol levels. And generally speaking, though, replacing saturated fats with unsaturated fats, so replacing things like red meat with white meat, reduces both total cholesterol and bad cholesterol numbers and reduces cardiovascular risk. So in a low-carb, high-fat diet, ideally you might have some fatty fish at least twice a week, and that would be for those omega-3 fatty acids that can help your HDL, which is your good cholesterol. So one thing as a caution, it's not always rainbows and butterflies with low-carb diets, is that carb restriction and nutritional ketosis can increase your risk for something called diabetic ketoacidosis. And that, especially for people that take insulin, if they excessively withhold insulin, that increases their risk of something like diabetic ketoacidosis, or certain medications can also increase your risk for diabetic ketoacidosis. So going back to our list of diets, here are a more filtered list of diets with data that shows that it can help prevent or treat diabetes. So the Mediterranean diet is something that has a lot of evidence behind it in support of it, especially for reducing cardiovascular risk, so for like heart attacks and strokes. So I bet if there was a cardiologist giving this talk, I'm sure they would be very excited about the Mediterranean diet. Things like the DASH diet, the low-fat diet, a vegetarian diet, a low-carb diet like we just talked about, intermittent fasting, which we'll talk about shortly. So all of these things have pretty good bodies of data supporting their use. So it's not just about low-carb dieting. So when it comes down to it, we talk about the 3 S's of choosing a diet plan. You want it to be safe, you want it to be simple, and most importantly, you want it to be sustainable. Because we often talk about using the word lifestyle instead of diet, because you kind of want to get out of this diet mentality where you're just going to do it for 3 months or 6 months and then go back to normal. You really want to try to do something you can do long term and make a new lifestyle out of it. And you want to pick something that you prefer.
Can't disagree with that.
Thanks. Yeah. So talking a little bit about intermittent fasting, since this is really popular. So one thing, the premise for intermittent fasting is that studies have shown that most Americans consume calories the majority of the time that they're awake. And if you think about it, sometimes in your day, it's true. As I was preparing for this talk, I was kind of going through a stretch where I was not eating super healthy, and it was true. You get your Starbucks in the morning, you eat your meals throughout the day, maybe you nibble in the afternoon because you're trying to hold out till dinner, and then maybe you eat something after dinner, or like at night you hit up your pantry. And then by that time, you've already eaten, 16 hours of the day. And so most Americans are like that. And the problem is that calories, especially from carbs, put you in a high insulin state, which promotes fat storage. So what is intermittent fasting? This is something where there's tons of different definitions. So that's where it can get a little bit confusing. Some people will do something where they're like completely not eating, like the true definition of fasting, 1 to 3 days a week. But people define those fasting days very differently. So some people will do the true literal definition of complete fasting. Some people on their fasting days, they'll just go extremely low calorie. So they might cut it down to like 500 calories a day. Or some people define intermittent fasting as time windows of eating or time restricted feeding. So for example, they might flip that 16:8 ratio so that they're fasting 16 hours of the day and then only eating between an 8-hour window. And that time-restricted feeding also has different schedules. So for example, there's like the conventional 16:8. Some people do something called the Fast 5, which is 19 hours of fasting, 5 hours of eating. Some people do 12-12, which is what Oprah has done. So there's a lot of different definitions of intermittent fasting. But the bottom line is that there is data that intermittent fasting and or time-restricted feeding can be beneficial. It can improve your health numbers, it can improve your weight loss, and it can improve many different factors that are listed here. And there's really minimal long-term risk. So if you think about it, there's no real downside to eating in a certain window. There's no downside to skipping breakfast if that helps you reduce your calories, lose weight, improve your biological markers. And the reality is for certain people, once again, everything is individualized, but for certain people, it's easier just to maybe mentally to flip that switch where you're just like, all right, I'm not going to eat until noon, and after 7 p.m., kitchen's closed. I'm not going to eat anything else. And for some people, like me, it's easier just to kind of think of it as like a binary, like I can eat now, I can't eat now. But for other people, it might be too hard to follow. The other thing is to remember that with diabetes, you have to be aware of your medications if you're adopting something like an intermittent fasting diet, because you might be more likely to have low blood sugar if you all of a sudden switch your eating patterns. So if you are taking medications that can make your blood sugar go too low, please discuss with your doctor. Just to talk briefly about exercise, these are the American Diabetes Association exercise recommendations. So exercise may promote weight loss, especially when combined with dietary interventions. And their recommendation is that most adults with diabetes engage in 150 minutes or more of moderate to vigorous intensive exercise per week, consisting of 2 to 3 sessions a week of resistance exercise. And one thing I wanted to highlight when talking about exercise is the reality is it's really, really hard to out-exercise a poor diet, right? So just because you're going to the gym and you started working out with a trainer, that doesn't mean you can continue to eat poorly. Just to kind of do some rough numbers, to lose 1 pound a week, the average adult needs to reduce their calories, so increase their calorie deficit by about 300 calories per day. And if you think about it, it's a lot harder to run for 30 minutes on a treadmill versus skipping a baked potato. So, and especially every day of the week, times 7. So you might say, hey, I can run for 30 minutes. But the reality is running for 30 minutes every day all week versus, skipping a baked potato or cutting a baked potato out of your day. So eating is the main pillar, and then exercise can help on top.
And if you are going to start an exercise routine, it's important to get cleared by your physician first. Make sure that you are ready to rock and roll if you're going to get started with that. You don't want to go cold from not running at all to running 30 minutes a day every day. And really, we think of exercise as being this big commitment. We have to run. We have to do these really gigantic gestures in order to make an impact. And the reality is you just have to find 1 or 2 activities that you can tolerate, hopefully that you really enjoy. Maybe that's dancing around your living room. It doesn't have to be something intense where you go to the gym and train really hard, although it can be if that's something you enjoy. So think about something you might enjoy and just get started.
For sure. And yeah, so that moderate activity that we talk about, it's really anything that would make it so that you can't complete your sentences. So for example, think about that time when you're like walking with your friend, and sometimes you can't finish your sentences, so you're having to like stop and catch your breath. You might not be running that fast or walking that fast. So whatever kind of gets you to that point where you can talk but maybe can't finish every sentence, that would be what moderate activity is. So whether that's at a medium pace, a medium walking pace for you, or maybe you can run, a 6 on a treadmill and not hit that point, it's really a relative thing. So I definitely appreciate that comment by Samantha. Now, I'll talk briefly about behavioral interventions. So obviously there's a huge mind-body component when it comes to weight loss. And so, there are a lot of different things to consider. So there's structured assistance. So we kind of talked about this earlier, but you can get counseling, coaching, and the bottom line here is whatever program you might pick to help with behavioral support, you want it to be frequent, you want it to be high intensity, to be able to identify your triggers and your barriers and what's making it harder for you to lose weight. And the reason why sometimes it's especially crucial to see a specialist that understands the mind-body component of weight management is that there's oftentimes some complicating conditions that can affect our journey on weight loss. So something like binge eating disorders, bulimia, night eating disorders. Until I started to do research on this, I didn't realize that there's a significant part of the population that will actually wake up in the middle of the night and eat. That's not something I personally have struggled with. So when I first heard about it and how common it was, that was foreign to me. So you might want to see a specialist if that's something that you struggle with that can help you with that specific issue. Also, a lot of us struggle with emotional eating and things like that. So it's really important to not hesitate to get medical attention for like eating disorders if that's something that is playing a role in your weight loss journey. I want to talk about medications, both diabetes medications, non-diabetes medications, and weight loss medications. And there'll be a lot of graphs here. So remember, this is a YouTube stream. You can pause it. So don't feel like you have to catch everything at once. And I don't want to bore you all by reading these slides. But this is something that happens in a lot of my patients with diabetes. And I call this the snowball effect. And it can go against you. So that what happens is, say you're diagnosed with diabetes. You start taking some of these medications, you start to lose weight, or you start to gain weight, and then your numbers start to get worse, and then you need more medication. So you add on insulin, and then you start to gain more weight. And over time, it creates this vicious cycle where you're gaining weight and then adding on more medication and then gaining more weight and then adding on more medication. And it creates this negative snowball effect. Now, this snowball effect can work in your favor. And this is where I try to coach my patients to say, it's hard to turn the tide, right? Imagine the snowball rolling downhill. But if you can turn it around, you can actually use the snowball effect to your favor, right? Because if you start to lose weight, then you might need less medication. And if you're taking less medication, then it might become easier to lose weight. And so it can create the snowball effect in a favorable way, but sometimes reversing that trend is really challenging, and that's why it takes a lot of techniques and motivation. The other thing is that a lot of these diabetes medications that we use, some of them are awesome at helping people lose weight. So those are going to be the ones on the right side of your screen that are weight loss negative. So things like Invokana, Jardiance, Farxiga, Trulicity, Ozempic, Rybelsus, all the ads that you see on TV talking about weight loss and diabetes, because these are medications that people generally like because they help you lose weight. But there's a lot of medications that many people with diabetes are taking, including my patients, such as insulin, Actose, glipizide, things that do actually make it harder to lose weight. So you might want to talk with your doctor and make sure that if it's right for you, that you're taking more of these medications on the right side of the screen rather than the medications on the left. The other thing is this table has a lot of different medications that are not diabetes medications, and that they can impact your weight. So a lot of people are taking psychiatric medications, for example, like quetiapine or risperidone. And these medications can cause you to gain weight. So you might not even realize that you're taking several of these medications that are making it harder to lose weight. So it's always important to be your best advocate, look at your list of medications, maybe line it up with a list like this, and next time you see your doctor, you might want to say, hey, Dr. Ahn, or somebody on this YouTube stream I watched, you probably don't want to say that. That might not sound too reliable. But say, I talked to a doctor, or I looked at a list, and this medication, might be causing me to make it harder to lose weight. Is there anything else I can switch it to? And there might be a safe alternative for you to be switched to. Or maybe you can stop it altogether. So, be aware that medications, while they often are helpful, they can make it harder to lose weight. Now, there are FDA-approved weight loss medications, so medications that do help with losing weight. Generally, they're indicated for people with a BMI greater than 27, with comorbid conditions like high blood pressure, high cholesterol, or diabetes, or anybody with a BMI, a body mass index greater than 30. Interestingly enough, one study showed that only about 2% of people that are eligible for weight loss medications actually take weight loss medications. So it is something that, for a multitude of reasons, a lot of people don't take weight loss medications. And I'm not saying here that everybody needs to be on weight loss medications, but it is an option that you may want to discuss with the doctor, because they can both help with weight loss and improve adherence. One note is that a lot of times, in medicine, we get medications started and they just kind of get added to our list and no one ever takes them off. So I would encourage you to think that if it doesn't help you, if you're not losing significant amounts of weight after 3 months, then I would probably stop that medication and talk with your doctor about trying to find a different one. I'll leave this slide up here briefly, but I won't go into it too much for several reasons, including time. But this is a nice little graph that compares several different types of weight loss medications, things like phentermine, things like Qsymia, things like Victoza or Saxenda, and Contrave. These are all the brand names of the generics that are listed at the bottom of the screen. So there are some good weight loss medications that can help quite a bit. And also, there's a lot of exciting research coming down the pipeline about new medications that might make even more of an impact on weight loss. Things like Plenity, which is an interesting type of capsule that you actually eat, and then it's kind of like a sponge in your stomach, and it actually makes it so that you're not as hungry, and you take it twice a day. That's a new medication that is hot off the presses. There's something called semaglutide, which is originally a diabetes medication called Ozempic, but they're doing studies on using it purely for weight loss even outside of diabetes. And then there's other medications that are still being researched and in the pipeline. So there is, since the last time you looked into weight loss medications, there might be really good options, because the world has changed quite a bit from like the fen-phen disaster of 20 years ago. So real quickly, I won't go too much into this because that's probably not why you signed up for this slide deck. But what about weight loss surgery? I will say that it usually is covered by insurance if your body mass index is high enough. So if it's above 35 with comorbid conditions, or if it's above 40, regardless of your conditions. And the reality is actually that weight loss surgery is the most likely to offer the best likelihood of long-term weight loss. And there are many different types of weight loss surgery. There's things like gastric sleeve, gastric bypass, lap bands, stomach balloons. So there's a lot of different techniques that are available. And weight loss surgery now has been around for over 20 years. So there's a lot of good long-term data showing that they can be done safely and they can be done effectively. And so you might want to lean towards a weight loss surgery option, especially if you have a long history of trying different diets, or if you find that your weight is yo-yoing, you're going up 20 pounds, losing 20 pounds, going back up 20 pounds. So it might be a good choice for you then. I'll kind of fly through these questions or these slides because I do want to have some time to answer some questions. But there's a lot of really good data behind supporting a weight loss surgery as having better outcomes than medications alone. And that's what this slide deck shows. I'll go a little bit slower so that you can actually look at it easier when you're doing it on replay. And this study is talking about weight regain after surgery. And so that's a common concern, right? Is we all know someone who has regained all the weight after their bariatric surgery. They lost a bunch of weight in the beginning and then they regained it all or more. And those kind of examples stick out in our brain. But one study actually looked at over 4,000 patients, and that 15 years after surgery, compared to the control, which is that top graph, pretty much all the other bariatric surgery programs had better weight loss outcomes. So there was some weight regain, as you can see on the graph, but still, overall, the net loss is quite impressive, even after 15 years. And same with mortality data. So anyways, I think the bottom line is you want everything to be very individualized. And here at Hoag, we have a bunch of resources. So Samantha and I are from the Mary and Dick Allen Diabetes Center. There we have registered dietitians. You have endocrinologists like me. And then Hoag Medical Group has offices in Irvine, Huntington Beach, and Aliso Viejo. And here are names of adult endocrinologists at those offices. And they're all my friends and colleagues, and they all are very knowledgeable about managing diabetes and helping you with weight loss. So if those are things that you're interested in talking to, you can ask your primary care for a referral or set an appointment up with them. And we are in the early stages of building out a weight management program here at the Diabetes Center and at Hoag. So stay tuned for more information on that.
I would also like to invite you to join us for our type 2 diabetes virtual support groups, which are offered currently twice a month via Zoom. And if you're interested in learning more or registering to join us, you can find that information under community education on the Hoag Hospital website.
Cool.
Hope to see you there. Now we have some questions from the audience. All right. So Melissa says she doesn't like most meat and chicken is okay, but she ends up eating more carbs because she has an aversion to meat, red meat. Do you have any suggestions for someone dealing with that?
Yeah, so I would really look into some of the whole food plant-based options. So I didn't really do a deep dive. I probably, if I could have added a couple more slides, it probably would have been on vegan options or vegetarian options. But there's a website called masteringdiabetes.org. And that's a group of people that are really big believers in a whole food plant-based or vegan option. So they have really good resources for doing a plant-based approach to weight loss and diabetes.
Excellent. Thank you, Dr. Ahn. The next question asks if commercial programs add anything to their food to aid in weight loss since their food looks delicious. And I think this person is wondering, what the benefit is to potentially joining a program where they provide the food versus providing your own food.
Totally. So I don't think they add, at least the legitimate ones, right, like the Nutrisystems and Jenny Craig's of the world, don't add anything magical in terms of, to make you lose weight. They often will include things maybe sugar substitutes, right, or sugar alcohols, and kind of zero calorie substitutes, but it's not, medicinal or anything like that. And I think the benefit of these programs is at least that it's structured. So if you're like me and you're a horrible cook, it's a lot easier to kind of get something and microwave it or get something in a package versus having the temptation of going to a restaurant and picking the right choice, right? It's like sometimes I'll go to the fast food chain and I'm like, I'm going to order a salad from McDonald's. And then I get there and I'm like, number one, please, right? So it kind of takes out that choice and allows you to have more structure.
Thank you very much. All right, this next question says, I'm not overweight, but I have type 2 diabetes. I'm confused. Will losing weight still help me reduce my A1C? So maybe talking about if you have type 2 diabetes, but you're not overweight, where does that leave you?
Yeah, and that's a great question. So I would say a couple things. So if you're truly not overweight, then I don't want to recommend that you lose more weight. So not everybody needs to lose weight, and I'm glad that you asked that question. I would say, though, that if you're of certain ethnic backgrounds, so for example, Asian people of Asian descent, I'm Asian, as you probably can tell, the ADA actually has guidance that our cutoffs for weight are actually different than non-Asian people. So for example, the ADA considers that that overweight BMIs for Asian people can start at 23 rather than a BMI of 25. So there may be a chance that maybe if you're Asian or of Asian descent, that you might actually fall in an overweight category when you don't realize. But if your BMI is not in an overweight category, then no, I would not recommend that you go out of your way to lose weight.
There are many people who have type 2 diabetes and are not overweight, so perhaps knowing to consult your physician separately and find out how you can improve your own management.
Definitely.
Couple questions before we finish off here. What do you think about monk fruit? Is this bad like artificial sweeteners?
Yeah, so it's tricky. I wouldn't say that it's necessarily dramatically better than artificial sweeteners, but given the choice, it might be a better option because it's a little bit more natural. That's kind of the same thing about stevia, right? If you made me choose between stevia and aspartame, then stevia is nicer because it has more natural origins. But I don't think it's way better or the same as not eating it. So yeah, it's a better option if between artificial sweeteners, but I don't think it's perfect.
Maybe we need a presentation just on all the different types of sweeteners.
For sure.
Last question. Any suggestions on how to manage the feeling of hunger that can happen when you're starting to make changes to your diet?
No, or no, period, bye. No, yeah, actually I do. And I think you kind of ask the question in the right way, in that what I tell patients is I think if you know that it gets better, that can help you mentally, right? So for example, when you go on a low-carb diet, whether you're going on an aggressive low-carb diet or just cutting back on the carbs that you eat, your body goes a little bit into withdrawal and you become really hungry. And those first 3 to 5 days can be really, really painful. And you're just like, wow, I am the hungriest I've felt in months. But sometimes mentally it might help you to know that that hunger issue will get better, and that if you can tough it out for say 3 to 5 days, then you'll find that your appetite and your hunger levels will dramatically improve. So kind of just mentally knowing that it gets better might be enough to help you. Other things to consider sometimes would be like in those first initial 3 to 5 days, kind of cheating a little bit more on things that still follow your diet but aren't necessarily the most healthy. So for example, if you're doing a low carb diet and you need to kind of get past that sugar withdrawal mode, I might encourage my patients to eat things that aren't the most healthy, like bacon or like steak, right? So it's not something that you want to necessarily overeat steak and bacon all the time, but during those 3 days while you're trying to like retrain your body on getting with, over carbohydrates and getting used to eating less carbs, it might be helpful to kind of eat more bacon and eat more beef or something like that, or steak on those first 3 days, just to kind of emotionally get yourself past that. So those are the types of tricks I would recommend.
I'd also love to add a couple of things
For sure.
I thought of while you were sharing those tips. Making sure that you're eating foods with fiber in them can definitely help with staying full longer and also help dull potential blood sugar spikes that you're working on there. And certainly consulting with a dietitian to brainstorm some foods where you can eat a higher volume of the food, maybe to help you stay full longer, but it might be different than what you're used to eating. And also the behavioral interventions that you mentioned. If that prolonged feeling of hunger is a struggle, maybe that's something that a behavioral specialist might be able to work with and help resolve over time.
For sure. All right, so I think that's all we have for time right now. So I hope that was helpful. If you have any other questions, feel free to reach out to us at the Diabetes Center or talk to your primary care provider or ask for a referral to see an endocrinologist or a registered dietitian. This YouTube live stream will be available afterwards for review, and it was really great being able to share with you, and hopefully we'll see you at some point.
Thank you.
Bye-bye.